No?
No.
All right. First thing I want to say, I heard some breeders ask where you get Calzor. My wife Julie here, raise your hand, is an expert on Calzor. So just basically talk to her during the break, and she will help you do that. And then the next thing I want to say is that I am in the United States a member of a non-veterinarian committee to reduce the incidence of brucellosis. And so I want to mention about brucellosis in cats because I think, especially in the United States and also in Mexico, I don't know anything about Canada, that feline breeders are not aware of the incidence of brucellosis. So if it's all right, I'm going to spend a few minutes talking about that. Brucellosis in the United States is Brucellosis in the United States is a major problem that we're facing right now. And just this year, what is this, June, I've already had 11 cases that I've dealt with in cats. Okay, now that compares to probably about 750 cases in dogs. Okay, but it's still there, and I want you to be aware that there are tests that you can run.
I think there was a question here.
Okay.
Did you have a question?
What is it? Yeah.
What is it? Okay, that's what. Brucellosis is a bacterium, so it's a bacterial disease. It causes reproductive failure. It causes abortions. It can cause eye lesions, skin lesions. It can cause basically low birth numbers. It can cause nothing until later on. So you can actually, your cat can actually pick up and be exposed to brucellosis and not show signs for 2 or 3 years. Your cat can have brucellosis and have kittens that don't show signs for 2 or 3 years. So that's the importance of testing. Okay. How is it transferred? Brucellosis is transferred. Is this okay, Stefan, if I do this? Because I think it's really important to do. Okay, I know it's... Okay, well, I'm not talking about neonatology now. Okay, so basically, how is it transferred? It's transferred in the semen. It's transferred in vaginal fluid. It's transferred in urine. It's transferred in feces. It's transferred in saliva. It's transferred in skin lesions. It's transferred any which way but loose. Okay? So, pardon? Yes.
How long is it viable in the environment? Let's say, for example,
The good news is it's not viable in the environment too long unless there's an ideal condition, and in most cases that's not the case. So basically, it likes cool weather, and it likes high humidity. So we don't see it and worry about it too much in the environment. We're worried about in kittens and cats that have been exposed. Okay, and the other nice thing about brucellosis is that it can easily be disinfected out of your kennel. You know, there are diseases such as panleukopenia that is very difficult to disinfect out of your kennel, but brucellosis is easily disinfected, and it responds to most disinfectants on the market. So that's my spiel about brucellosis. I want you all to be aware that it's out there. So, how do you follow Ariane and Emmanuel that can make puppies sound sexy? I can't do that. I'm from the Midwest. So, we'll do our best here. So, feline neonatology is, to me, the most exciting topic that I could be asked to talk about. And the reason being, and I'm going to go back and tell you my story now, the first C-section that I ever did in the first 3 weeks of my career was a Great Dane Basset Hound cross. Okay, and the female was obviously the Basset Hound. The second one was a Persian breeder who just got married, and she was all happy because with the money that she was going to make from these kittens, she was going to buy her new husband a boat. Unfortunately, after the C-section and having cleft palates, that didn't happen. And then the third one was probably the most influential C-section that I ever did in my life. And the reason being is that it was a human doctor And the human doctor was a neonatologist. And at that time, neonatology was a specialty that was just basically new. And I'm sure there's somebody in here that's old enough to remember when we did C-sections, we didn't have that grade of anesthesia 30 years ago. And basically, we had no way, really, or any thought of resuscitating kittens or puppies. We basically, and I don't want to use the word throwaway, but that's what we did with kittens and puppies because neonatology as a specialty in veterinary medicine was unheard of. And when we had a couple puppies from this litter that were doing poorly, and I suggested euthanasia, he was appalled. And he basically set me on the road and showed me the way that we can reduce mortality and save these kittens and puppies. And to me, there's nothing more exciting than saving a kitten and puppy, because we can talk about how to get them bred. We can talk a little bit later about diarrhea, but saving the puppies and kittens is the most exciting thing that we can do. So neonatology was a very early interest in mine for that reason. And I had actually gone at that time to talk to 3 veterinary schools about maybe setting up programs and learning more. And at that time, they just thought I was kind of crazy. But I don't think so. So way back when we had mortality levels about 20 to 30% after C-sections, okay, we basically, in our practice, reduced them to about 5 to 7%. So we did that by first knowing what was normal. I'm amazed all the time that breeders really don't know what's normal for an early neonate. Okay? So I think if we know what's normal, then we can recognize what's abnormal. So we're going to, first presentation, we're going to talk about what is normal. And then the second one, we're going to talk a little bit about what is abnormal and how to recognize it and what we can do about it, because that's the most important thing. So this is the story of what I consider kittens, is that they seemed all right yesterday and now all of a sudden they're crashing and close to death. Because kittens are not small adults, okay? There is nothing in many ways that we can say that kittens are like adults, except that in some ways they look at it. I'm going to define, okay, neonatology and neonates from birth to 4 weeks. There's others who say it's birth to 2 weeks. There's others who say it's birth to 6 weeks, but I'm going to use the 4 weeks because we are getting close to what at 4 weeks? Getting close to weaning, okay? And after weaning, we see diseases and we see causes of death that are different than during the first 4 weeks of life. So I'm sure when Arian talks about kitten diarrhea, he'll probably talk about diarrhea in neonates, but he'll probably spend more time on after weaning or during weaning. So this is my belief that neonatal mortality should not be considered normal. I'm under the belief at this point in my life that we should do just about everything within reason to save these kittens. So we already talked about that. We understand what is normal. If we understand what's normal in a neonate, then we certainly can understand what is abnormal. Examinations in neonates are difficult. First of all, they're small. They're often presented late in illness. And so hopefully, again, if we recognize what's normal and abnormal, we won't wait till it's late in illness. The other is, it's hard to auscultate these hearts and lungs. So it's difficult to do that. So are we going to know what's wrong with the heart and lung? Well, we can do it, but it's very difficult. Abdominal palpations are difficult. They don't have much fat, so it's hard to differentiate what's normal and abnormal in the gut. And it's also obvious difficult to assess veins in newborns. After 30 years, I'm terrible at it. So let's talk normal. What is normal? First of all, we need to understand that these kittens should be born with very red or hyperemic membrane. If they're pink or pale pink, then they're in trouble. That's not normal. The reason they're hyperemic is because there's an influx of red blood cells from the queen. And that's critical for their survival. So one of the first things that we do if we're going to evaluate a neonate is look at the gums. And we want to see very red gums. This lasts for about 7 days. Their hematocrits, or packed cell volumes, which is the percentage of their red blood cells to their blood, is usually up around 60 to 65% at that time. That's way above normal in an adult. So, now we have our first question. So a good indicator of health in neonate is what? First one we're going to talk about is the fecal quality. Is it the tail length of the kidney? Okay, so maybe I gave that one away. Weight gain or heart rate? So go ahead and plug in your answers. Well, we got 80%, 81%. So weight gain is the most important way that we give a good indicator of health in the neonate and as they go on. It's easy, just as Emmanuel and Ariane said, you should have a scale around. In my second presentation, I'm going to talk about what I think you all as breeders should have in your cattery. And one of them was a scale. Okay, so if we recognize that the kitten was born in a certain weight and that kitten is gaining weight, that is a very good indicator that that kitten doesn't need immediate attention. If they continue to lose weight or not gain weight, then we need to interact with that kitten. We'll go on from there. So birth weights, they vary by breed, and it's important, I think you were going to touch on that, or you did touch on that different breeds have different birth weights, and you probably obviously know what's average in your breed. 80, 140 grams is the normal range for kittens. They gain about 10 to 15 grams per day. And so if we're weighing them on a daily basis, then that's something that we need to know. They double their birth weight by about 2 weeks of age. And it's a reliable indicator of health. That's what we talked about. So that's normal. What's abnormal is what? Not losing weight or not gaining weight. They have a strong suckle reflex and vigorous. Okay? Even though they're born, their neurological systems are immature. We have a suckle reflex. And the reason that is developed is because that is so important for survival. Survival instinct has taken over from the immaturities. They nurse and they sleep constantly. And so when they're sleeping constantly, it is important for us to watch how much twitching they do. Okay? Because that twitching is their neuromuscular system being developed. And if we have about a 60 to 70% time that they're twitching, then that's a good indicator that they're developing. If they're not twitching very much, then that is an indicator that we need to step in and see if there's a problem that we can fix. Okay, so observe twitching. Obviously, we don't want them crying longer than 15 to 20 minutes. It's normal for kittens to cry. It's one way that they attract the attention of their mother. We as adults, as babies, we cry. What do? We get the attention of mom. Sometimes the dad, but mostly the mother. So they cry longer than 20 minutes, we have to be concerned that they're cold, that they're in pain, okay, because kittens and neonates feel pain. They're hungry, and maybe the lack of queen and she's not doing her job. One of the reasons that queens don't do their job in nursing is hypoglycemia in them. So we need to be aware that maybe we're dealing with a case of her not wanting to nurse because she's borderline hypoglycemia. Okay, so that's something we need to be aware of. This is our next question. I'm hoping everybody here gets this right.
What is the question?
The question is, a normal temperature of a 3-day-old kitten would be Bunchen? Okay. Okay. We have 11% correct. Okay. The correct answer is 97 degrees.
Oh, wow.
Okay. And this is critical if we are going to save kittens. We need to have a thermometer around. One of the first indicators that a kitten is doing poorly is a temperature that's dropping below that 97. So one of the items that you need to have in your cattery is a thermometer. And know that we have 97 degrees and we better be aware of that. Because it isn't usual for a kitten to have a high temperature. But it's very usual for a kitten to have a low temperature. And they have a very low range or mild range that they can drop below. We're going to talk about that in a minute. Okay, so it's critical that we know normal. 102, 101, that's a normal adult temperature. But again, they're not adults. So kittens are unable to regulate their temperature when they're born. And that's a good thing and a bad thing. Okay? It's a bad thing because, again, when it drops, they're in trouble. It's a good thing for 2 reasons. Anybody know why it's a good thing for 2 reasons? Okay. The question is, what are the 2 good reasons why their temperatures are below an adult temperature? Okay, well, I'll tell you. One is, it lowers their metabolic rate, which means they're not on mom constantly, which means she has time to recuperate from nursing. And the second reason is kittens are born with low oxygen. I think Ari and Emmanuel talked about that. So they're hypoxic, and if they have lower body temperatures, then their demand for oxygen is lower. So those are the good reasons. But the bad reason is that they have to rely on the queen and the environment for their temperature because they're unable to shiver, okay? They're unable to vasoconstrict their blood vessels to conserve heat. So we have to be aware that from 97 down, that is a great indicator of we're in trouble when we need to do something about that. So they reach their normal body temperature about 4 weeks of age. The other indicator that we like to see are respiratory rates. Okay, and the reason being is that they change. They're low the first week of life. They're down in the 10 to 18 range. We can observe that. So that's another indicator of normal that we can observe and make sure that these kittens are healthy. So Ariane and Emmanuel talked about the queen licking the kitten to stimulate those respirations. I heard the thought of that when we have kittens born, we don't basically shake them. I was guilty of that when I graduated because that's what they taught us to do. I'm sure some of the older breeders in here probably did that too.
Yep.
We know now not to do that. Pardon?
Still doing, I'll still do it.
Okay, see, and so we have an all-timer that's basically going to continue because of work for you. Okay. We have cutaneous stimulation that increases the respiration when that mom is licking their abdomen and licking their back and licking underneath their tail. That also serves to stimulate respiration. Yes, sir.
So with monitoring that yourself, would you need a stethoscope, or how would you do it as a breeder yourself?
Just stand there and watch how many breaths per minute.
Okay, so you don't need a stethoscope or anything?
No.
No.
No. So their pulmonary response, in other words, their lung response to low oxygen is minimal, unlike adults. when we're in a situation where the oxygen levels are low, we breathe faster. They don't. Okay? And their work of breathing is increased. They have more work. Doesn't make a lot of sense, but if you think about it, kittens' chest walls are very flexible. So they have to push against that harder to get oxygen than we do. And they're susceptible to hypoxia for all those reasons. And we want to keep the environment, the irritants low. So we talk about disinfecting and we talk about cleaners. We have to be aware that cleaning and disinfecting causes irritants to be. Julie and I, when we came here, we went to O'Hare, and they were basically, must have been cleaning somewhere, but the level of Clorox bleach that all of us, not just Julie and I, people were rubbing their eyes, holding their mouth because the bleach was so high. Okay, so we need to be aware, no matter what disinfectant and no matter what cleaner we're using around these kittens, it can be very irritating and actually cause death in these kittens. So kittens also have what's called suckling anemia. So I told you the first 5 days, their packed cell volumes or hematocrits can be up around 65. They soon drop down to about 27. That's a major drop. So now they were above normal, now they're below normal. So, and if you're not sure what hematocrits and packs, again, it's just a percentage of the red blood cells over there to the blood right there. And it's normally around 40, 45, can be 47 in adults. So now they've gone from 65 to 27. And when we have low hematocrits, we call that anemia. And we also know when we have anemia, our response to bacteria and viruses may be limited, and parasites. We don't know for sure what causes it. Our theory is that it's low levels of iron. We just don't know. And it's also, if we have a high hematocrit, it's a good indicator that these kittens are dehydrated. So, they can maintain their blood sugar levels, that's a good thing, for about 24 hours of life. And after that, they are prone to hypoglycemia. And the reason being is they don't have very much fat in their body, okay, very little fat. And their livers don't respond well to producing sugars when they're needed like in an adult. Kidneys aren't developed until 4 weeks of age. In some ways that's a good thing, and I'll tell you a little bit about that later, why it's important to know that the kidneys aren't developed. They can't concentrate their urine, and the specific gravity, which is the measure of concentration of that urine, is very low. Now, the importance of that is it's a very good way to tell if these kittens are dehydrated. Because if we stimulate underneath the tail and get a drop or two of urine, and it's very dark and yellow, they're dehydrated and they're in trouble. If it's clear like water, that's good. The other thing is we're supplementing fluids in these kittens. We don't want to over-supplement them, and we certainly don't want to under-supplement them. So the concentration and the color of the urine is a great indicator to get us on the road to saving these kittens. Their urine protein and glucose are higher than adults, so if we're using urine strips, we need to be aware of that. And if we're going to use medications in newborns, we have to be very aware of what we're using, because a lot of these medications will basically wipe out their kidneys before we know it. Their liver is not as developed as an adult. It's difficult to assess if we're having troubles with liver with blood tests. So, decreased metabolism of drugs. So as Manuel said earlier, you don't want to jump just to an antibiotic for the sake of it, because that antibiotic will probably do more damage than good. It's possible to assess colostrum intake with blood tests. So we can actually, with 2 tests of the liver, assess if they've got enough colostrum, if we need to. So the neurological testing is difficult. They're uncooperative. If you picked up kittens, they don't want to be picked up. So they're very difficult to work with there. Their nervous system isn't fully developed, and they have naive experiences. What's that mean? So if we go and try to pinch their pain or assess that they're having neurological deficits, they've never been tested before, so they don't know the correct response there. And the cranial nerves are developed. And again, that's a survival. It's required for survival for them to have cranial nerves that are working. Why is that? Well, because of suckling. Okay, they have to suckle, and they have to have vestibular function. They have to know where they are in the world so they can raise their head up to get to mom. Now, they can't hold their head up forever, and they certainly can't right themselves, but in the beginning, they certainly can get to mom. And if they can't, then that's an indicator of poor health. They also can taste. They have a blink reflex at birth. And why would they have a blink reflex when their eyes are closed and they can't see? Anybody have any theories? It's part of the facial nerves, okay? Yeah, it's part of the facial nerves. So basically that's why they have it. Their muscle coordination, you know this, is lacking at birth. So it's very hard for us to evaluate their development by muscle. We talked about they can raise their head. They have an uncoordinated gait. So again, very difficult to evaluate. They make it hard on us to tell if things are going right. They can withdraw from pain, but it's slow. You know, when I went to school and we were taught to declaw puppies, I was told emphatically they didn't feel pain. That's how old I am.
And it's still going around.
So, if anyone's ever declawed a puppy, you know they do feel pain. So it was pretty obvious right off that what I was taught wasn't true.
Yeah.
Okay? And their spinal cords aren't mature until about 6 weeks of age. So healthy kittens, their gastrointestinal tract is developed at birth because why? It's necessary for survival. Now, I was talking to Emmanuel yesterday about a new study that came out in humans that the bacteria in the uterus is essential for newborns to start developing their correct microbiome, which is basically the gut bacteria. And we know, and we'll know more in the future, that the gut bacteria play a role in immunity, they play a role in health, they play a role in weight. We know that now. Okay? So the question I'm asking is that we talked about endometritis, and we know that bacteria in the gut. Is the endometritis normal or is it abnormal? I don't know that answer. Okay? Are the bacteria in the uterus that we're finding, are they normal or abnormal? Because if we use antibiotics, again, just like Emmanuel said, prophylactically, are we damaging those kittens' microbiome? That's going to be in the future. Okay, so they have a neutral pH in their stomach at birth, and the reason being is why? They want to absorb colostrum. Otherwise, those proteins would be destroyed. They also have increased GI permeability, which means those proteins can get into where they're needed, because that is their protection, those immunoglobulins. At birth, we say that their GI tract is sterile. I'm not sure about that now with this new study, so I think that's something that's going to need to be determined, that maybe these kittens are born with bacteria in their gut. I don't think anyone can say at this time. Historically, we have said it's sterile, but I do think with this new evidence, that's something that's going to need to be studied. So they do have an immune system. They get the immune system innately, and they also get it from passive transfer from the colostrum. They get about 75% of their immunoglobulins from mom. Their thymus is undeveloped, okay, so it will develop, but it takes about 3 weeks before it even starts to kick in and provide that immunity. So that is, the first one's going to be quick. The next one I have is a little bit longer because now later we're going to talk about how to save these. So remember, okay, we need to understand what's normal. We already learned a few things that we can tell. Twitching, okay, temperature. Temperature is critical. What's that?
Gum color.
Gum color. Are they suckling? You know, it's easy to tell if they're suckling. We just put our finger in our mouth and see if they are. Okay. We need the concentration of the urine. So, knowing those, when we go to part 2, then we'll talk about how we take steps and how you take steps. Sorry to throw that at you. How we take steps to save these. Okay, so have a good lunch. And when we come back, we'll do that.